Well, personally for myself, my son was given an opioid medication at the age of 14, and he developed a substance use disorder as time went on. As a parent of someone with a substance use disorder, a lot of times you feel isolated, like you can't talk to anybody, you feel like you're always being judged, and as a parent you judge yourself enough. And just like our children or our loved one that has a substance use disorder, they also judge themselves. I've actually one time in particular, I got a call in the middle of the night from a young lady saying that my son wasn't breathing right, and I could hear him through the phone, and I told her that that's called a death rattle. You need to call 911. And I was about 4 miles out of town. I told her I would be there as soon as I could, so I grabbed a couple of boxes of Narcan and I headed into town. And I got there about the same time as the ambulance. Now the ambulance is only a couple of blocks away, and I got there at the same time. As I'm getting out of my car, I don't know what they were doing, but they were just sitting in the front seat. And I yelled at them and I said, "He's overdosing in there." And I ran inside and I Narcaned my son before EMS even got in there. And I have to wonder if it was a heart attack, if they wouldn't have ran in there, more quickly.
So I've been in what's called a recovery coach, peer prevention specialist, and so my role is bringing people in to recovery, people who don't realize that there's treatments available and options to get well. And so I'm kind of a navigator, resource broker, we call ourselves. So decreasing the stigma, that's something that I really enjoy and specialize in the most is messaging. Our words matter, whether we're a person like myself who identifies as someone in recovery, or someone who supports me or supports their loved one, their coworker, their staffer. Understanding that our words matter, and what we need to do is learn about the messaging and the harmful words. Alcoholic is a very harmful word. Junkie, drug addict, that's a harmful word. Whereas we can say people still in active use, and we say reoccurrence rather than a relapse, right? So our words matter. It's all in the messaging. And there are so many wonderful trainings out there for messaging that I think it's important. And not just that, it's a responsibility of our communities and community leaders to make that really apparent and aware and available. Well, efforts like this are so important for two major reasons. One's, like you mentioned before, the messaging, our words are so important. They're so damaging, but at the same point, they can be that much healing as well. Our responsibility as community members is to learn what are the resources, what can they do, who did they see, who did they talk to.
Addiction is a disease, and when people cut off all connection to people that are addicts because they're addicts, it makes them crawl deeper into that hole. There's a thing, the opposite of addiction is connection. People need to be connected. When they're not connected to anybody, and their family completely wipes them away or turns away from them, they're not going to get better. They need to have people in their life supporting them to help them get the help they need.
My name's Scott Schweitzer, and I am a methamphetamine and fentanyl recovering addict. I personally believe that addiction is a disease. I've heard a really good analogy about it, and it's that you're in a burning house. The house is on fire. You're not going to try to figure out why the house is on fire while you're still inside it. You're just going to get out of the house. So the first step to getting out of addiction is to stop using, and hopefully within that journey, it doesn't matter as much what other people think about me and my affliction.
My name is Amanda Kuhn, and I've been in recovery for 6.5 years. I think I'd like to say to others that maybe aren't in recovery or haven't experienced addiction that You know, we are normal people too. And just like anything, we overcome those barriers. And I think that if I look back at my life before, I would say the addiction took over to my life now, it's still 100 times better. That the recovery has opened so many different doors and has completely changed my life, that I'm thankful I went through what I went through, and I'm thankful that I have the connections and resources I have now, and I feel that that helps to make me a better person and helps to encourage me to encourage other people and give hope to others.
All right, so my name is David, and my sobriety date is May 3rd, 2016, so coming up on 7 years. I think that having open, honest communication is the biggest thing. Doing stuff like this, you know, not being afraid to sit in front of these lights and cameras and say, hey, I used to struggle with drugs and alcohol, but look at me now. You know, I think that's the biggest thing, is just understanding that I don't think there's a whole lot of people that aren't affected by it to some degree. Maybe they don't struggle with drugs and alcohol themselves, but they have a family member who does, or they have a coworker who does, or they have somebody they've run across or they used to go to high school with that does, you know, or unfortunately passed away from it, you know. So I think just being willing for people that are in long-term recovery or even a week sober, being like, hey, you know, this is where I'm at and I'm not ashamed of it. And I think that's going to go a long way in really breaking what that stigma does, and that's breaking that fear off.
My name is Kelly Meekum, and I have been 12 years successfully in recovery. You know, look at the successes from someone that has been touched by addiction and has lived such a painstaking life, and look at the ones that have made it, that haven't overdosed and died. Being open-minded and giving someone a chance and understanding that this is a disease and it's something that someone has to work through and completely change who they are and their thoughts and their behaviors. You know, just basically giving somebody a chance to be the person that they want to be. Because I don't believe I've ever met anybody that wants to be in active addiction and is happy.
Okay, so I started my treatment of patients with substance use disorder when I started treating pregnant women. I work in the largest OB practice in northern Michigan, and when we had moms that came in pregnant and using substances, I wanted to make sure that they could get the treatment that they needed so that they could take best care of their new babies. I soon learned that women are not in isolation. They are part of families that have other members that need help and treatment. And so I went on to start working at NMCHIR Recovery Center and helping men, women with addiction issues, and then now have become the Munson Medical Center Substance Use Director, so I can even reach more people and help more people change their lives. Substance use disorder can affect anyone. It doesn't matter how privileged you are or how much that you have suffered during your life. It can hit any home and any family. And most people do know someone, whether it be a family member or a friend, who has struggled with a substance use issue.
I'm a family medicine and addiction medicine physician, and since 2005 I've been taking care of substance use disorder and general medicine patients in northern Michigan. In my experience, because I'm a family medicine physician, I really like to work not just with the patient, but also learn about their families and about their history. So it really is rewarding to me to see not just the benefit to the patient, but to the family in terms of relationship building, better function, and better joy and success in their lives.
My name's Gabe Riem, and I'm from Manistee, Michigan. I've been in recovery for 8 years. What I think is important to remember about harm reduction is that it takes time to change. And myself, I'm an overdose survivor. There's been multiple near-death overdoses that I've had, and if the Narcan wasn't available, I would have never had a chance for recovery. And a lot of people aren't gonna get into recovery their first attempt. I mean, a lot of times it's gonna take a number of attempts to get into recovery. And then so it's really important to stay safe along the way, whether that's a needle exchange so that you don't get hepatitis or HIV, or if it's, you know, keeping Narcan on your person so that you can be saved if you have an overdose. I think it's really important that you have to stay safe even throughout your addiction so that you do have a chance to recover.
There's multiple pathways to recovery, and people don't typically stop using substances, become completely abstinent, and life is perfect after that. You know, there's ups and downs along the way, and one of the models that are out there helping people right now is harm reduction. And it's just a way that people can start making those changes in their life while they're getting the assistance of medicated assistant treatment or whatever pathway they're choosing. But while they're on that, they start to make those major changes that will help them the rest of their life.
The reason I do it, the reason I help people is because they change their lives. There's nothing I do in medicine that is more fulfilling than seeing someone who has no transportation, they don't have a GED, they have maybe lost their child or children. They get their substance use disorder under control, and they become the people that they want to be. They're able to be parents, they're able to get their GED, they're able to get the job that they want. When I actually ride my bike everywhere, but when someone comes in and tells me that they got a new car, I know they made it because they've got a job that allowed them to make payments, and it's the best thing to look out the window and see them, like, they're so proud of what they've done. And knowing that their reunification with their children and the passion that they have behind that, it's just absolutely beautiful.
I think that this is fantastic, whoever it's going out to. You know, I think that it's much needed, and I think doing videos like this and having a face to recovery is what's going to break the stigma off of it, you know, and seeing that people can change. You know, obviously you guys don't know what I was like when I was using, but I can tell you it's not the man that's sitting in front of you right now, not even close. So I would say anybody that's even thinking about it, there is hope. That's one of the biggest things. There is hope, and just grab onto it, even if it's a little piece. There's plenty to go around.
Simply say, I love you, I'm here, what can I do to help?